You're not going to get patients unless you put yourself out there, this way or that way. And really understanding your target audience is going to help you understand the methods of marketing that will be effective to you in this point in your business journey. Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about the third topic of our marketing series about marketing channels. But first, if you like this content, please like, subscribe, and share with anyone you feel will find value. So, first and foremost, the whole point of marketing is to create leads for your sales team. In home health and hospice, there's not really leads and sales teams and all this stuff. It's more you're trying to put yourself out there and going out and making all of these different connections and trying to find patients. In other companies where you're a B2C kind of company, let's say, you might put a lot of emphasis on traditional marketing efforts. But in healthcare, it's a little bit different. First of all, the service by law is undifferentiated. You cannot offer a service that's different than the next door home health agency. And so all home health and hospice services are really providing the same thing. Unless you're doing a niche, as we've covered in a different episode, and kind of the pros and cons of that, or unless you have some kind of super duper staff that's been recognized previously or whatever, you're really just presenting an undifferentiated service. And so the only real marker of your service differentiation is going to be your care quality. Unfortunately, that is not find outable outside of direct experience. And so the only way anybody, whether it's a referrer or a patient or whoever, can really get to know your company is by trying you out. In today's episode, we're going to talk about different marketing channels. And so the purpose of marketing in home health and hospice is to get your name out to as many people as possible and hope that you're there at the right time for when the service is needed. By default, most people, like the average person, doesn't know every kind of healthcare category, every kind of licensure category, and what they do, and if they're ever gonna, and examples or the best companies of those categories. And so to have people know about you before the service is needed is very important. And the only way that you can really do that is by really going after marketing as much as possible. Also, in home health and hospice, as we've covered in previous episodes, there are a lot of laws around things you should avoid and, various payments and gifts and things like that you can't do. And so we are going to now talk about ways that you can approach marketing for your home health and hospice agency that might help spread the word and will also be a little more than what the average company does. In a previous episode, we covered that a lot of companies will not have an online presence because marketing in this industry is very relationship based. And so you're going to have, relationships with your referrers in that they might know the owner of the company or, whatever. Even in the case of something like pharmaceutical sales, there's still relationships between the pharmaceutical sales rep and the referrers. So the different doctors or hospital practitioners, whatever. And so you really want to do as much as you can in the marketing direction to get your name out there and differentiate. So the first part of marketing in home health and hospice is understanding your target. And there's really 3 targets that are available in home health and hospice. One is very obvious, and that's the physician or other kind of referrers. So that might be hospital discharge planners. That could be SNF people that are discharging and things like that. So of course, refers are a very important part of, where you can get business from. And ultimately, regardless of whether you are focusing on refers or the other two sources that we're going to talk about, you still need the referrers to refer the service. B2C companies have to worry about just attracting the consumer and possibly their competition. In healthcare companies, you also have to essentially convince or interact with the referrer. And so this leads us into the other two categories that are very important targets and a cool way to kind of differentiate your marketing activities from other agencies who are probably already just really going hard after referrers. And those are patients and caregivers. And these are two very different demographics. So patients right now, just imagine the average 65 to like 85-year-old that you know. Of course, there's a big difference between the 65-year-old and the 85-year-old, but this is our general demographic when we're talking about home health and hospice. The average 65-year-old right now is probably online to some degree, is probably consuming a mixture of like TV and online content, and is probably a little bit more like savvy than the previous generations who were just not online at all. So this is like kind of our first generation of online patients. And so this demographic is really, they're down to do the online stuff. They're down to do the traditional TV, all this stuff. And they're also down to read things and, get like brochures and stuff like that. Whereas like maybe in 20, 30 years, you might not be able to get your average patient to like look through your 40-page brochure or your, admission package with all that information. It might be a lot more online focused. This patient can do it all. And so you really need to understand this target kind of piece of your audience and consider, where does the patient go? What does the patient do? Like where can we find this person? And the cool thing about this specific patient is you can find them everywhere that you can potentially find anyone. And so the same people that you found, wherever you found the patient 20 years ago, you can find these guys. And wherever you will find the patient in 20 years, you will find these guys. And so they're this like kind of bridge generation that does the old school stuff and does the new school stuff. And I think that's a really interesting and cool demographic to consider. One of the pros of interacting with this patient is that they might appreciate the convenience of online back and forth. So how do you send your, admission packages? Traditionally, and until now, this is legally required, that you provide an entire admission package at the patient's home. Well, maybe this patient demographic will also appreciate having online copies and things like that. So these are some processes that you want to consider to attract the new gen of patients. One of the more interesting and effective marketing efforts that we've seen in like older times, like, 20 years ago or whatever, was, if you can remember this far back, like about 20 years ago, there was a big push for like, do you have diabetes? Do you need a wheelchair? Call us at 1-800-wheelchair, whatever. And so they would put these advertisements on TV and patients called. It was like a very effective ad and they got a lot of patients from that. I'm sure a TV advertisement was very expensive, but the amount and the kind of business that you can get from that TV advertisement, where it really got the people where they were, was just, phenomenal and worked really well. So the next demographic are those patients' caregivers. Now, if we're talking about a 65 to 85-year-old patient approximately, we're talking about like 35 to 65-year-old caregiver. And typically the caregivers are going to be spouses or children. When we say caregivers, we're talking about the children of these patients usually. If you have a spouse, that's the same kind of category as the patient, unless there's like a giant age difference, whatever. But when we're talking about caregivers, we're really talking about their children. And what we're saying is for this demographic, and if you really want to understand this demographic, they are on social media, and that's that. So if you can become some kind of voice of social media, and I don't mean like you have to have like 100,000, subscribers or followers or whatever, but just like any kind of thing that you can do on social media where the children of those patients will find you or can search, a question that you can answer will be a really big deal. Especially because, as we've said in a previous episode, a lot of agencies still haven't made that like mental switch from the old school way of marketing to the new environment. We see this happening more and more today, but it's still kind of in not the beginning stage, but like it's in the beginning stages. Like online home health and hospice marketing is not advanced right now in the industry. And so for these caregivers that are about 35 to 65 and probably really more like 45 to 65, this age range, they're probably on Facebook. They might be on Instagram. They might be on like Meta kind of stuff. And they're probably looking for like answers about how this process works. A lot of like, what are you taking off my hands? Things like that. And so one of the things that I would really focus on is really talking about the CHHA service or the hospice aid service, because that's really personal caregiving, right? Like it's like hygiene, meal prep, like all these like things that help the caregiver. And so I think that would be a very interesting way to attract people to the service. But of course, the patients have to qualify for that specific, whatever discipline it is that you're going after or whatever. Really forming a really comprehensive idea around who your target is important, because it will then inform your marketing efforts from there. So let's talk about some traditional marketing. First, they would market to doctors' offices. This is like the number one starter pack way of marketing for home health hospice. And essentially, what people would do is like, let's say, print a list of doctors and start just going one by one, door to door, trying to get in the door through the receptionist, trying to make an appointment with the doctor or the staff, and really trying to solicit referral that way. Usually this involves bringing some kind of low-cost treat to the office, like maybe like cookies or whatever. To be successful in this method, you have to do this a lot. Most doctor offices have some kind of sales rep from all these vendor healthcare companies like pharmaceuticals, home health, whatever, like all sorts of things. Pharmaceuticals and pharmacies are different things also, right? So they have a lot of different healthcare kind of vendors and representatives soliciting them all day long. And that's not how they make their money, as if they're doing it lawfully. How they make their money is by treating their patients. And so every time you try to take time away from them, you're taking time from their family time, or you're taking time from things that make them money, aka treating patients, and are probably like much more important on their list than like sitting through your luncheon or whatever. And so you have to go a lot to the doctor's offices, once a week to the same doctor's office, or whatever like this, and really bother them. So it's either easier for them to listen to you and get you out their door so that you're not bothering them all day long, or you have to provide a really like convincing sale, essentially, which is hard to do in an legally undifferentiated service. So if you can do that, great. Like, whatever methods you can think of to do that. The other traditional marketing source is hospital discharge planners. Some hospitals require contracting to work with them. Some hospitals will just refer off the cuff to whatever agencies that sign up or bring them lunch or whatever. So bringing people lunch, just like in general in any place, is a really good way to like get the staff on your team. But there are like financial limits to what you're allowed to spend before that becomes controversial to like the various laws we may have covered in the first episode. Some of these laws include that you really want to stay away from are the anti-kickback laws. I mean, the kickback law is really like, don't pay per referral kind of thing. Don't do that. That can land you in jail. But what happens is, and why we say like cookies and things like that is, okay, if I buy your cookies from the supermarket and bring it to your staff, or cupcakes or whatever, and it's like $8, like that's fine. If I'm providing your whole staff with lunch weekly, okay, am I influencing you through these things? That might be a problem. If I'm bringing a Rolex to the doctor as a thank you for referring me 10 patients, okay, we have a really big problem. So you really want to avoid tripping up on any of these like legal issues that we covered in the first episode of this. With hospital discharge planners, just like doctors, they have a million people begging them for referrals all day long. And just like doctors, there's one big important concept that everyone needs to understand. They don't care about your company. They don't care if it's you or the next guy, or like they have literally hundreds of people on their list that want to work with them. If you asked 100 agencies if they want to work with a hospital discharge team, 100 people would raise their hands. And so the extent that you're able to get referrals from them is what level of quality you provide their patients. And the threshold for what's acceptable in that is if the patient complains to them about your service, they will never use you again. Because what they don't want is a headache. They don't want patients calling, complaining, wasting their time, sucking their energy out, blah, blah, blah. And so as long as the patients are like happy enough with the service that they don't complain about it to the referring source, generally you're going to be okay. And you provide the care, of course, you provide your not bare minimum, but like you provide the required standard of care. You do all the things that the doctor has asked and no one complains about you, you're golden. So these are really like the factors of maintaining the relationships with the referring sources. But to get into the relationships, it's a little bit more complicated and just requires a lot of consistency, a lot of waiting. And the big thing is that when they refer you that first patient, you have to staff it, you have to take it. If you don't take that first patient, you're probably not going to get another call, because oftentimes the referral sources will try out the next guy when the guy before them has messed up. When they get patient complaints and now they're like, this is not worth using this company. They used to be good, but now they suck, like that. And so you might be, if you've gotten on the list of like the next companies and they call you and you can't take the patient, you go right off that list, probably. And so when you're first marketing, especially traditionally to like doctors' offices and hospital discharge planners, expect to get like weird patients. Like you're going to get the patient that bothers them a lot. You're going to get the patient that is very far away and no one can cover it. You're going to get the patient with like some niche required service that their other standard companies can't cover. And so understanding that is what's going to get you that first patient is important. And considering what kind of niche if you want a niche and what kind of niche you want to go into. If you take like an insurance no one takes, then you'll probably get that insurance plus whatever other insurances that come along with it. And so these are some considerations for traditional marketing sources. The next marketing source is online. And we've kind of touched on this a million times in the last episode and this episode. We're really talking about social media, Google search, Yelp, care.com, discharge planning sites and softwares, and email marketing. So let's just jump into them a little bit. With social media, you're not targeting referrers, you're targeting patients and caregivers, and probably mostly caregivers. And so you really want to gear your information on social media towards that group. If you're the age of what we've talked about, kind of like the 35 to 65 age range, and like your whole demographic around your social media is that, then you're really targeting to caregivers. And so just really think about the information you're putting out there. think about every time somebody asks you a question within your service that's like coming from the caregiver, keep a list of that. Who asked it? Was it a patient, a caregiver, a referral source? And that way you can start to kind of create a marketing plan, a content plan for your social media. For Google search, this is kind of my beef with that whole aspect. If you're going to be creating constant content, fantastic. But typically agencies will be much more established before they start making content all day long. If you have time for this kind of content creation, which is very in-depth, great, do it. And you'll probably be okay with Google and pulling up on their searches, because I don't think that like every agency out there is focusing on content creation like that. So, it could be like your marketing niche. But that would be the last thing on my list, honestly, to do. Next is Yelp. So the pros and cons of Yelp. Not all agencies go on Yelp. If I suggest not going on Yelp until you have truly established quality in your service. Unless you have a quality service, Yelp can hurt you more than it can help you, because it takes one problematic review to just set you off completely. And another thing about review-based sites is that anybody who does give a problematic review, you really want to like immediately reply to it with your side of the story, but in a professional way, not like bashing them or whatever, but like just really trying to explain the circumstances around the situation. Because sometimes the complaint is based on mismanaged expectations and not actually a problem with the service. It might be something like, how come the nurse doesn't stay 5 hours? I'm pissed about that. I wanted someone to stay half the day while I'm at work with my mom. Well, the nature of this service is that they come for a 45 to 1 hour visit once or twice a week. They're not here to babysit your elderly parent while you're at work. So sometimes just a mismatch of expectations can be the problem, and explaining those circumstances, if you feel like you're in the right in those moments, will be a lifesaver. Another example is care.com. Most people are not acutely aware of the home health and hospice industry, and so they might go to places like care.com first just to find help with their aging parents. Of course, once they start talking to people within the healthcare industry, like doctors and stuff, they will be immediately informed that these kinds of companies do exist. But like, it's not the instinctual knowledge that people have about healthcare like hospitals are. The next kind of online marketing source that you can consider are discharge planning sites and softwares. There are certain softwares and sites that we can give an example of this in the article or, whatever, that you can sign up to and then be notified when a hospital discharges somebody, and then not bid for that patient, but essentially like whoever responds to it first gets it or something like that. These sites and softwares are great and they sound super promising, but I wouldn't base my entire marketing system off of it, because a lot of people are on there, and typically the patients that go on there are the ones that are like harder to staff. So like you might get a bunch of Medi-Cal patients on there, but not Medicare patients on there. And so you really want to have those considerations. And the last version of this is email marketing. The email marketing piece is only going to work once you've established some kind of like client base or some kind of like base of people that want to receive your content, and if you are creating content. And so it kind of goes along with the Google search stuff in that, if you're actively creating content all day long, then sure, maybe start email marketing, and that's super effective, but it requires constant content creation. If you are not constantly content creating, I wouldn't do these half measures, because like it's not going to work at all and you're just spinning your wheels essentially. So one of the big considerations of online marketing is that these are long cons. These are long-term plays. They're not like, I posted something, I'm going to get a lead or I'm going to get a patient or whatever. This is like, you need to post consistently or whatever for like months, and then maybe one person will come. But if you get good at it, you could get a significant amount of referrals this way. So it's just really like, do you want to put the time and effort into this? Or is your time better spent through traditional and more direct marketing methods? Both concepts require consistent, constant effort and time, and to repetitively do these things. And both of these marketing efforts will need a long period of time before they work. You're not going to get a doctor to give you an appointment the first time you go into their office and like ask for it. They're not waiting for you. So you really want to consider where your skills are, maybe where your local industry, how they do things, and try to differentiate that way, and just kind of things like that. But these are all important considerations when you are thinking about your marketing program. And finally, the last piece of this puzzle is the affiliate marketing concept. So what does that mean? That essentially means partnering or collaborating with other related but non-competitive vendors, services, and groups in the community. This could be like DME companies, adult day health centers, veterans groups, pharmacies, wherever it is that your patient is going or your caregiver is going that is not home health or hospice related. Maybe it's a church. Maybe, you can like do a little booth to measure blood pressure outside of the church on Sundays. I don't know. Just think about, where are these people? Where's my target audience spending their time outside of my service? When they're not looking or researching home health, what other things are these people doing? What places are they visiting? And so on. And it could be as simple as putting your business card in a pharmacy, or, hosting bingo night at the adult day health center, or going and reading to senior citizens in the nursing home, whatever it is. Or it could be doing online stuff with any kinds of, collaborate, like, making a video about medication reconciliation with a pharmacist. I don't know, whatever. Just think about this creatively, because your options really are traditional sources or all of these other online kind of things and whatever. Long story short, you're not going to get patients unless you put yourself out there this way or that way. And really understanding your target audience is going to help you understand the methods of marketing that will be effective to you in this point in your like business journey. Day one might be different from like 10 years from now. And so a lot of times people will start with the traditional methods and then slowly expand out and like add into more online and affiliate kind of methods. Whatever it is you choose, understanding your target is top priority. That's about it for the marketing channels. And again, I'd like to remind you that the purpose of marketing is to create leads for your company. And that's that. So if you enjoyed this video, please like, share, subscribe for more of our content. And again, this is Mariam Treystman from the Home Health Consultant. Thank you. Bye.